Are you looking forward to ski season? I can tell you I certainly am. And to ensure you have an enjoyable and safe time, you'll want to watch this week's Health Talk. We're coming up next. Hi, I'm Dr. Eric Baser. Today we're going to discuss one of my favorite topics, preparing for the ski season. Actually, the ski season is my favorite. We're going to be talking about senior physical therapists Desiree Elliott and Steve Irwin. Welcome both to Health Talk.
Thank you.
This is probably the best show I've ever done.
Yeah.
And let's just start. I'm going to show some pictures, which I can't avoid, so I apologize. But let's just start and say, why is it important to think about preparing for ski season, Desiree?
It's all about injury prevention. We want to make sure that you are being safe on the slopes but having fun at the same time so that you don't risk losing the participation in the ski season because you lost out due to an injury.
And Steve, how long should you be preparing before ski season? I know we all should be exercising all the time.
Exactly.
But for those people that are weekend warriors and haven't exercised, is it too late? I know we're right now, this show may be shown anytime, but we're right now at the beginning of December.
Yeah. Ideally, if I had my perfect scenario, I'd probably say give yourself 2 months to kind of really prepare for the season. That way you kind of really can build the strength over time and just kind of get right into ski season pretty seamlessly.
And that's what we're going to talk about, but I can't help myself. I'm going to bring up some of my personal ski pictures, and just so we can show them to the folks at home, and maybe have them give some sense about why I enjoy skiing so much. So this is we can look over there now. That's actually me in Zermatt, Austria. Behind my right shoulder is the Matterhorn. That was from the balcony of our room there, and it was one of the most wonderful trips we ever took. This is actually, skiing in Europe is very different than skiing in the United States in that it's much more about eating and less about skiing. So you sort of ski to these restaurants and then you sit and you enjoy some elegant pasta or wine. Here we are. That's actually the Matterhorn behind me. The ski lifts go up quite high. This was skiing on a glacier. And this is Jackson Hole. This is on a snowmobile trip we took, but those are the Grand Tetons in the background. That's part of the elk herd that was there, and that's my wife and me at Jackson. We're up on the mountain. You can barely see it over my left shoulder. You can see it here. There's actually fog in the valley, so it gets warmer as you ski down, but it was a scarlet blue day that day. And that's my son and me again. You can see the fog in the valley, but Jackson Hole's a wonderful place to ski. Oh, so it's really fun, but I think one of the things that is wonderful for me as the physical part of skiing are the views, the experience of being up high in the mountains, the fresh air, the sun. It's just a great experience. I don't know about you guys.
Absolutely, and I really enjoy the physical aspect of it too, because at the end of the day, you're tired, you had fun, you had a good time. And it's a nice to kind of get outside when in the winter you really can't, do much.
My wife and I talk about being ski tired, and that feeling at 4 o'clock in the afternoon really is fabulous after you've.
And it's also probably the best night's sleep you get after a day of skiing. That's
exactly right.
Especially if you don't do it all year long. So.
But to really enjoy it the best, you really do need to be in shape. So maybe you can say a few words about what people should be thinking about.
Right. Well, as I said, again, it's all about injury prevention. So you want to make sure if you're a weekend warrior going up there for the first time that you're really talking to the people that you're renting skis from or any other, individuals who have been skiing for a long time to make sure that your equipment is top notch.
We were talking about that before the show, and I think we can't emphasize that more strongly enough.
Right.
If you're renting equipment, make sure you get good equipment and that you're well fed.
Right.
Exactly.
And if you're getting equipment, making sure that whoever's renting the equipment is making sure that you're wearing it properly and that it's really fit to you and that you're really honest about your, skill set on the slopes because different skis can be meaningful for different things, whether you're going...
Some of the more expert skis, they're great if you're an expert, but they're actually harder to ski on if you're a beginner or an intermediate. So you don't want to, the bravado will actually make you ski worse if you're skiing on the wrong ski.
Yeah.
Steve, also boot fitting I know is incredibly important. You may want to say something about that.
Absolutely, and for both skiing and I would kind of piggyback on top of that snowboarding, you want to make sure that your bindings and your boots are not too loose. If they are too loose, you run the risk of furthering injury of the ankle and the knee.
And that actually happened to my wife, and I used to tease her. She did not really bind her boots down tightly. She liked the comfort. She liked them feeling like slippers, and unfortunately, she got caught in a slow twisting fall, and her leg was able to move in the boot, whereas her foot was stuck to the ski, which was lodged in a mogul, and she broke off her inner ankle, her outer ankle, and that little piece of bone at the back. It was a major injury that required surgery to repair, and I think, again, the bindings are wonderful now, and I can talk a little bit about that, but they're so much better than they were 20 or 30 years ago. But if your foot's loose in that boot, the bindings aren't going to work.
Exactly,
No.
and skiing is kind of a unique sport where your feet are kind of essentially bolted to something that's not moving. So all that force that would normally get absorbed by your ankles is now getting translated up into the knee and hip. And that's why you see a lot of knee injuries with skiing.
Well, that's a good point. I had never thought of it that way. Yeah, knee injuries are quite common. What kinds of things can you do? Quite common skiing, and I know I hear a lot about ACLs among skiers, anterior cruciate ligaments. I think people mostly know it as ACLs. But you were saying that beginners tend to have a different injury, don't they?
Yeah, beginner skiers tend to get an MCL injury or a medial collateral ligament.
That's
so it's
sort of
down one on the inside of the knee.
On the inside of
and
the
the
knee.
reasoning being is because they use kind of that snowplow stopping technique, and that puts a lot of strain on the inside of
So
the knee.
they end up
Exactly.
pushing their knee up. So what kinds of exercises should people be doing to help improve their day, improve their enjoyment, as well as prevent injury?
Well, I think it's all about knowing what muscles surround the knee itself. So a lot of it is a quad exercises. Hips play a major factor into controlling instability with the knee itself. So, a lot of people tend to go into like the squats, the lunges, things like that.
Yeah, good skiing, a lot of people don't realize, is you are crouched down a lot of the time. And I think anyone that, if you want to experience what kind of shape you can do a half deep knee bend and hold it there.
Right.
Exactly.
Because the real good skiers are down, sort of working in that. Standing up too straight is what most people do.
Right. And, I think Steve and I will both agree that it's not just something that you can do once and then be ready for the ski season. Like he said, 2 months prior to knowing when you're going to go helps develop that muscle and helps develop a little bit more strength so that, again, you're really preventing the injury per se.
So Steve, should you be focusing on the quads, the quadriceps, the thigh muscles, and are there better exercises for the skiers?
Anything in weight-bearing positions, you don't want to go to the gym and do the machines, like the leg extensions, because that puts unnecessary strain onto the kneecap and onto the ligaments itself. But any exercises really where your feet are on the ground, different types of lunges, squats, different things with resistant bands to kind of work on the hips, because as Desiree said, the hips are vital for providing your knees with decent stability, especially with any kind of dynamic movements.
And I'll say I had always heard this, but there was a period of time I was skiing an awful lot. My kids were young and we had a place up in Maine. I was skiing an awful lot and I started to experience bilateral knee pain with patellofemoral osteomalacia, where the kneecap literally rubs on the cartilaginous part, gets irritated. And I went to an orthopedist and he said, do quad strengthening exercises. And amazingly, they work. They really worked. The pain went away, and frankly, I haven't had that pain for 2 decades since. But it was actually limiting the skiing I was able to do. Why does that work so well? What is happening when your quads get stronger and your other muscles get stronger around the knee?
Sometimes what happens is your kneecap, your patellabone, kind of slides within this groove within your knee. And sometimes if the muscles are weak or if certain structures are pulling that bone off course, it puts stress on certain parts of the knee, which can eventually cause pain. When we're walking, you can generate upwards of 2 to 3 times your body weight just going through your knee. So that's a significant amount of force. Now, when you're walking downhill on a decline, that can jump up to 8 times your body weight. So then you translate that into skiing, you're putting tremendous amount of forces through that knee.
Repetitively.
Exactly.
So this stuff really does work. What I did was straight leg raises with weight, and it was not a punishing exercise by any stretch. But it worked.
Yeah, and that's kind of like where you begin. That's kind of considered kind of lower level in the progression, and then as we were saying, you can kind of work towards a higher level progression with like what Steve was saying before, the squats, the lunges. You want to avoid, again, anything that's over excessive on the weight, because that can cause a little bit more damage to the knee joint itself. So it's all about progression and safety with that.
If you go through the ski magazines, there are several machines that are promoted for skiing. These skiers, something where you sort of jump from one side to the next. Do you recommend those, or do you need those, or is that unnecessary?
I mean, I think it would depend on, again, your level of activity, your level of how much you exercise, per day, per week, things like that. If there's a question about whether or not you should be doing it, you should probably talk to someone who has a little bit more background in it to make sure that either one, you're doing it correctly, your form is correct, and then two, again, like the safety factor of it. You want to be able to build the muscle, but if your technique isn't right, or the quality of movement isn't doing anything for you, then you're really kind of working against yourself. So if there's questions about that, you should probably contact
So
somebody.
what are the best exercises people can do at home for their legs, for their thighs?
Well, I think to start off, you don't want to start too heavy and kind of get yourself into trouble where you're experiencing soreness and increased pain trying to get yourself in shape for season.
So taking 300 pounds and doing knee bends is probably not the
probably
best
not where
thing.
you want to start. Yeah.
In general, people kind of want to overdo things, and sometimes as therapists, we kind of have to scale them back and kind of start from a basic level. So kind of what you were alluding to before, the quad sets, the straight leg raises, different things on the table first, just to kind of get your body used to movement, and then slowly progressing to things off the table, like the lunges, the squats. And then
Now, for a while, squats in my lifetime have gone through multiple different thinking about them. When I was a young kid, we all did deep knee bends. Then for a while, we were told not to do deep knee bends because it puts stress on the ligaments. And what's the latest on full squats in terms of their utility and danger?
Well, I think like anything in moderation, it's okay. Everyday life, we're squatting all the time, whether we have to pick something up off the floor. So in that respect, it's okay. But when you're trying to go all the way down and touch your heel to your butt, that's too far. But we generally recommend kind of a 90-degree bend in the knee, which is
So just halfway down.
Yeah, almost like you were sitting down in a chair.
And again, when I was a kid, in doing track, we used to go up against the wall and hold ourselves at 90 degrees. Is that a good exercise? Now, that's an isometric exercise.
Correct.
Is that good or bad, or is it supplementary?
I mean, I would say it's like supplementary. It depends, again, what you're aiming for and what you're working for. I think, it's important to note that your quad control works in different angles. So, doing a full squat and then holding it in different positions is a way to work the muscle in different degrees of motion. So, would we say, like, yes, do this every day? Probably not. Again, working up towards it, challenging yourself to get there, and then going from there.
Now, how about for the back of the leg, quads, the hamstrings?
The
and others?
hamstrings. I would say, it's important because it does kind of attach back behind the knee to work on hamstring strength, but also like flexibility of the hamstring too. A lot of the time, our patients come in and that's one of the major muscle groups that are significantly tight on a person. So it's all about that balance. If you're working the quad strength, you want to make sure the flexibility around the knee joint is just as important as well.
And we'll talk a little bit more about maintaining that flexibility when we come back. I'll also have some more ski pictures that I can show you. So we'll be back after this short break to talk a little bit more about preparing for the ski season. Hi, I'm back with Desiree Elliott and Steve Irwin. We're talking about getting ready for the ski season or getting ready for any athletics, but we're talking a little bit focusing on skiing and the exercises of skiing. You were talking about the quads, Steve, often being tight in people. So should a quad stretching program be part of your preseason work?
Absolutely. The quads get tight. Also, the hamstrings also another muscle that really
That's what
gets
I meant,
tight.
the hamstrings. Thank you.
And, stretching is always something that you want to supplement into a strengthening program.
Now, what's the right way to stretch? Again, that's something I used to bounce up and down, and lately I hear you're not supposed to bounce.
Correct. The true method for stretching is you want to perform a static hold with a small degree of discomfort. You want to feel that you're doing something, and holding that for anywhere from 30 to 60 seconds. Once you get past 60 seconds,
So is that keeping your knees straight and touching your toes, or?
It all depends on what muscle group that you're trying to address in the stretching, because obviously different positions stretch out specific muscles. So, I mean, if you were standing and touching your toes, keeping your knees straight, yes, you're going to get some of the hamstring. But, you know, is it safer for you to be on your back and do kind of the same thing with pulling your leg up towards your chest? It probably is safer for your back. And then,
So you lie on your back and bring your knees up and then stretch that way?
Yep, that's one way to stretch the hamstrings, yep.
And how about other core strengthening, your back muscles? Because it seems to me, not as a physical therapist, but as a skier, you need to have a lot of strength in your core to sort of manage a lot of the twisting and weight shifts that are going on.
Absolutely, and it kind of depends on what kind of skiing you're doing. You know, the cross-country skiing, absolutely core is vital. You know, the downhill stuff is important, but you're going to need a little bit more control in the legs to prevent injury. But core work, everyone can benefit from core work, especially because we sit as a species way too much. So
and again, so when you, I don't think I've ever learned good core exercises. What are some good ones?
I mean, the thing about core is that really there's a whole variety of things that you could potentially do. And kind of going back to what we were saying before about progression, you know, there's stuff that you can do kind of on a mat, starting on your back, working kind of deeper core muscles themselves, and then adding, you know, dynamic activity with your legs, with your arms, kind of working that way. So again, it's working in varying degrees of motion, and you're not just kind of using static strengthening versus dynamic
Well, for somebody
strengthening.
who's at home, is not a physical therapist, are there places online they can look this up? Any places that you would suggest to learn about some of these exercises they should be doing at home? Or should they visit a gym and get a personal consultation?
I think sometimes it's just smart to kind of get the personal consultation, because again, a lot of times you'll find people doing the exercises, but the quality of the exercise isn't necessarily the right way. So then, you know, they're trying to address certain muscle groups if they're not really getting it because they're performing it wrong. Mm-hmm. So it doesn't hurt to kind of get a professional just to kind of watch you and see what your technique is and things like that.
And Steve, if you had somebody who came to you, said, I'm a skier, I'm doing this specifically for skiing, would you have a specific set of things that you would prescribe for them?
absolutely, and if you find that you're going to a place and everyone is doing the same exact thing, that's somewhere you probably want to try to avoid, because different movements call for different types of exercises. So having a tailored approach for specific sports and for every single person is kind of the best approach.
And when you see a person, do you have them go through an exam to see what their current strengths are and what their flexibility is so that you can tailor the program for them?
Yeah, you go through a clinical objective measurement exam, and you kind of look at their range of motion, their flexibility, their strength, and kind of from there, the findings you take, and again, like Steve was saying, tailor a program to them so that you're isolating out what exactly they need and what exactly they're trying to prepare for so that you can get them to where they want.
Jim, are there, when someone goes to a gym, do most of them get a personal trainer to do an evaluation? Do most gyms offer this as part of their intake? And then let me ask the secondary question. I know you work with the hospital physical therapy, but if somebody simply wanted to come to you to get a general sports evaluation and recommendation, can they do that?
Well, kind of the first question is, most commercial gyms nowadays do offer that kind of personal training, you know, consultation, at least for a few visits or a complimentary kind of, you know, examination, and try to figure out what kind of program you want to get on, you know. But, you know, like everything, you want to make sure that you're comfortable with your personal trainer and that they seem knowledgeable kind of as to what they're talking about. And I'll kind of let Desiree talk about the second question.
You know, if you do find that you're not really getting what you need from the personal trainer and you kind of want, you know, to get a physical therapy standpoint, our facility included, you just need, you know, a prescription from the doctor to kind of come in, and, you know, we would obviously have you come in and kind of meet with us and discuss what you're feeling, where your concerns are, things like that.
So physical therapy really needs to be prescribed by the physician, whereas trainers, and I should ask also, do trainers do they have a certification process? Do they have an educational process? Or can anybody be a trainer?
There's a gray area in that. You know, as of right now, I'm not sure of kind of the legislation right now, but you can take a weekend course, and as far as I know, you can become a personal trainer. Obviously, some are much, much better than others.
Yeah, that's not to disparage trainers, but when you have an unregulated
Exactly.
specialty, you can get any, as you said, somebody with a weekend course to somebody who's been doing it for 25 years.
Correct.
Exactly.
Yeah. You know, and again, with the physical therapists, you know, we do have the licensure. We do have more specific and long-term education kind of to get our degree in that field. So, you know, you can go to a therapist who may specialize in certain things that you're looking for and kind of get a better eyes view with what you're looking for as well.
Just to kind of add on into Desiree, Connecticut does have direct access where you can go to a physical therapist without going to a doctor for a certain amount of visits. So, you know, it's kind of something we're trying to put the word out a little bit more so the general public kind of understands. You know, if it's something not nagging or not serious, you can come to a therapist first. And
Yeah, and I always think of physical therapy as a rehab rather than a sort of well-person exercise introduction or entree.
Right.
Is that? But it sounds like you're, as a specialty, you're expanding your role.
yeah,
Right.
Because I would think you'd have all that expertise.
Yeah, and you know, I think as our kind of field progresses, you know, you try to go for like the preventative part of it. You know, you want to make sure that if you're starting to feel a little ache and pain, that it doesn't progress to something that is uncontrollable and that you may need, you know, further intervention or medical intervention from. And then, you know, unfortunately, sometimes we see it post-accident, post-injury, where that's where the rehab does come in, and, you know, it's a little bit longer in the process of recovery.
Now, going back to preparation for skiing, I'd like to ask you a little bit about aerobic exercise and cardiovascular fitness, and also just to alert folks that I'd like to bring up the rest of my pictures on my travel skiing, so I can at least share those. I'm sorry to bore people at home, but I'm just so enthusiastic about that. So tell me about aerobic. Oh, we've actually got this up. So I just want to show, this is St. Anton in Austria in the evening, and it's such a quaint, beautiful little town. And part of going to Europe is the skiing is gorgeous, but it's not as high quality skiing, I think, as it is out west. But the charm of being in these European towns and the internationalism, that was actually a day in St. Anton when it was so snowed so heavily we couldn't ski. The lifts were closed and all the passes were closed. That's my wife at the top of one of the hills. Over her left shoulder is the village of St. Anton. This is another part of that complex. I should think a complex. It's several villages, be up at the top. This is what I love to do about skiing, is when I finish and sit, have a drink overlooking the hills. This is Uberlech. And this is Stowe. Stowe is available to everybody. I think it's one of the most beautiful places in the Northeast. It's also Stowe, Stowe, Vermont. It's about a 4.5-hour drive from here. And contrary to a lot of what people hear, this is where we sit and have lunch. It's at the top of the mountain. And when sitting at the top of the mountain, I think the next slide is actually the view that you have looking out at the skier, which I never get tired of. It's just beautiful. And this is also at Stowe, near the top. And so hopefully for those people who are at home, convince them to do a little bit of skiing. If nothing else, just for the experience. You don't have to be a good skier to experience most of what I've shown there. Almost every spot of every picture there, you could get down on a beginner run.
Right.
If you could just, so it's an aesthetic, sensual experience as well as being an athletic experience.
Absolutely.
And I think you can partake of the former without being a great athlete, and just sort of to promote the sport. And it can be safe. The other thing, I asked you about aerobic condition, but the bindings really have changed the name of the game. I've been skiing since the early 60s, and when I skied then, and there were release bindings then, but routinely, not every day you skied, you would see somebody or several people take it down the slope on a sled with an injury. It's the exception now rather than the rule to see somebody who gets hurt too badly, because the bindings really are good.
Yeah.
If you use them right.
exactly.
Yeah, and I think it's just like anything else. Technology advances. You know, there's a lot of research that goes into, you know, injury prevention and things like that. So that's where you see
Right, we're
the
learning how
difference.
the twists and what velocities, and I think the bindings have been designed to accommodate most of those, so the skis come off and you don't twist. You don't have that propeller twisting your leg and breaking your knee, or et cetera. You were saying something about snowboarding also is a little different, and your feet don't come out of snowboards when you fall. What kind of injuries do you see there?
Typically with snowboards, we see a lot of ankle injuries. So there's actually something called snowboarding ankle, where there's a small fracture of the lateral part of the talus, which is a bone in your ankle. And the reason being is there's a few different types of kind of snowboarding shoes. You have kind of a more flexible shoe, which allows your ankle to move more. So you see a lot of ankle sprains in those. But then you have more of a rigid shoe, where that's where you kind of see some fractures and more of the knee injuries, because it's not letting your ankle move as much.
So the ankle actually absorbs some of that twisted turn.
Exactly.
And both in ski boots and now in the more stiffer snowboarding boots, you can't twist as easily. We've got about 30 seconds left. Do say something about aerobic conditioning for skiing. You know, is running good? How should people do that?
Well, I mean, I think if we're looking at kind of preventing knee injuries, running, you just have to be careful because there's a lot of impact that goes into running in general. So sometimes you can kind of get away with elliptical use, bike use, things like that. And then again,
I love the elliptical trainer, by the way. I think that's sort of the perfect answer for me.
yeah.
Exactly. So that's a nice compromise between kind of impact and aerobic activity. Absolutely.
And you can feel it in your thighs, too,
Exactly.
which is,
Right.
again, what burns at the end of a long ski runner at the end of it.
Right,
Absolutely.
exactly.
Well, you've got me all excited. Hopefully we can hope for snow up north
Yes.
for those that don't like to drive in it. Thank you so much. We're going to keep here because we have a question that we're going to answer.
Okay, thank you.
But when we come back, we'll answer today's health question. But right now, let's take a look at some of the upcoming events at the Western Connecticut Health Network. Hi, this week's question is, I walk almost every day. Do I need to do other exercises to keep fit? Well, here we again have the experts. Is walking enough of a physical fitness regimen?
This is probably the most asked question that we get a lot. And the answer is absolutely it's not enough. You know, walking is great, but you really don't use a lot of energy to walk. We kind of get a lot of that movement for free. So it's extremely important to start with kind of a lower level exercise and then kind of progress to some other different types of exercises.
The analogy that I like to use with my patients is like a house and foundation. And if you want to compare it to walking, your walking is like the house. But without a foundation, you're not going to have strength to support that. So like Steve was saying, you know, walking is good, but you can kind of improve and be better with adding exercises to your
So
routine.
is it true that in order to build strength, pure strength, you need to be pushing yourself to do things that are difficult?
I think you just need to push yourself that are doing things that are different outside of your routine. You know, you're not going to build the strength if you do the same thing over and over and over.
We've got about 15 seconds left. In order to get cardiovascular fit, don't you need to get your pulse rate up and your heart rate up for a period of time?
Absolutely. That's how the heart essentially is a muscle. So you also have to work it to the point where, you know, you feel some strain, but not too much where you feel out of breath or, you know.
So competitive walking might be good, but not just simply strolling around the level block.
Exactly.
Correct.
Unfortunately, that's all we have time for. It's a great topic. I think we all want to know about eating well, staying fit. If you have a question at home that you'd like to ask me or our guests on Health Talk, please contact us at healthtalk@norwalkhealth.org. I want to thank our guests today, Desiree Elliott and Steve Irwin, for coming on our show. I will see you next week on Health Talk. Stay fit.